Hello friends, I am Dr. Sandeep Bhasin from Carewell Medical Center. In this series of rhinoplasty talks, today I'll be talking to you something about depressed nose or the saddle nose. Saddle nose is the common name by which scientifically we call a depressed nose. So let's see what are the problems a depressed nose has. Now one thing is very obvious, you can all see that the projection or the height of this nose of these people who have a saddle nose is very low, is very less. The other thing that's important is even the length of the nose is not adequate, is little less in such cases. Third thing that we commonly see in these noses is where the nose are very wide. So we have to narrow these nose by surgery, by doing osteotomy or some other technique. Another thing that we see is that the tip of these cases nose is like projected upward. It's like a pug nose, it is turned upward, and the columella can either be pulled back or maybe very loose. It can be retracted columella or a hanging columella. So when we do a surgery for a depressed nose, we have to keep in mind we have to increase the projection or the height of the nose. We have to increase the length of the nose. We have to make the nose narrow. If it is too wide, we have to work on the tip. We have to decrease the rotation of the tip back. Okay, we have to make the columella normal, and we have to also give a proper shape to the nose, keeping all these things in mind. Now, one thing very important that we need to understand, in all depressed nose, there is some problem in the structure. Now, the nose has basically two structures. Upper 1/3 it is nose, lower 2/3 it is cartilage. Now, cartilage is a structure which is harder than the surrounding tissue structures, but it is softer than the bone. Now, cartilage is giving shape. Now, look at your ear. Cartilage is giving the shape to the ear, and one tendency of the cartilage is if you press it and leave it, it comes back to its normal shape. That is called recoil. In depressed nose, saddle nose, if you press this cartilage down and leave many times, this will not come back, it will not bounce back. So that is called recoil test, which is normally positive in a case of a saddle nose. So what need to be done? We need some good cartilage to give a support to the nose. So where can we get this cartilage? We do not use silicone implants. We tell people not to use silicone implants. That is very important because they have complications in long run, either infection, dislocation or other problems. So where we get this cartilage from? We get this cartilage from the ribs, that is called the rib cartilage, or from the ear, that is called conchal cartilage. These are the common areas where we are using. Our favorite area to get graft is from the ribs. So that is something we have to keep in mind. So friend, this is what I'll tell you now. In my coming video, I'll tell you more in details about the surgery for a depressed nose. Thank you friends, I am Dr. Sandeep Bhasin from Carewell Medical Center.